welcome to CINP Young Psychiatrist panel discussing about depression. In the previous video we discussed early effect on antidepressant. Lately a lot of focus has shifted on cognitive dysfunction. Nikolina, would you like to comment on that?
Yes, so actually cognitive deficits are very prominent in depression, and we have seen from studies that they exist both in one depressive episode, but also in major depressive disorder and intermediate depression. So interestingly enough, also relatives or first-degree relatives that are unaffected by depression also saw some cognitive impairments. So, as you probably know as well, anti-seizedness and almost every day is one of the diagnostic criteria in the DSM as well. So it seems that cognition could be, and it should be, a primary target of antidepressant treatment. Unfortunately, it is very hard to study the effects of antidepressants in clinical trials. So far, most studies have focused on elderly population, but obviously there are many confounders, possible dementia or other comorbidities. Interestingly enough, some studies from Catherine Harvey in Oxford have shown that antidepressant treatment with SSRIs produces an early effect on emotional processing, so how people actually perceive affective stimuli. So healthy people overall, they take more into account the positive stimuli, and they also remember more positive events than negative events, and that's part of resilience in daily life. In depressed patients, we see the exact opposite. So people are more affected by negative feedback, they recall more negative memories, and also when they are asked to do some computerized tasks, they identify more negative words than the positive ones. So Harvard studies show that early on treatment with SSRIs, so acute dose of citalopram and clinical dose, that produces effects on emotional processing before we see the actual effect on the mood. And further follow-up studies show that this is possibly separate than the effect on mood. I don't know if anyone else would like to
Fredrik, any update regarding newer
No, I just had a question, but I thought, like, emotional processing, that's one part of cognitive dysfunction, but you should also have, I imagine, the cold cognition or whatever it's called, that's separate from the emotional part, like basically working memory, executive function. Do we have any data on what antidepressants do on those measures?
Yeah, I'm very glad you asked that point actually. Yes, so I did mention that other deficits as well are seen in cold cognition, so attention, executive functions, decision making are seen in depressed patients. And there have been some evidence in healthy volunteers that are taking acute doses of SSRIs that there are very dissociable effects. For example, we conducted a study at the University of Cambridge with Parabasahak and Trevor Robbins, where we showed that acute citalopram dose produced very dissociable effects on cold cognitive functions. So, for example, the healthy volunteers became less cognitively flexible, and they had better response inhibition, but on the other hand, that left unaffected emotional processing. So we can see there is a dissociated role of antidepressant treatment. Why that is, it might be due to differential effect on corticostriatal loops, but this warrants further investigation. And as you know, it's very hard to actually conduct that in clinical studies because of the several confounders. So I should make a note here that over the last years, we have tried to measure objectively cognitive functions by using computerized tasks compared to the old paper and pencil tasks that were used in previous studies.
So let me open the topic up and by asking the short and long-term effect of antidepressant treatment in cognition. So, Zheng, any input?
Yeah, so as Nicola mentioned, it's already very difficult to measure the short-term effect of antidepressant treatment on cognitive functions. You probably need some better measurements than just the scales, maybe computer-assisted test. And I think it's even more complicated to think about the long-term effect of antidepressant treatment on cognitive function. But there is a concern of the use of antidepressant treatment on long-term cognitive function and also risk of dementia. I think there's a meta-analysis 1 or 2 years ago that meta-analysis on observational studies again, because it's almost impossible to do a randomized controlled trials of antidepressants on the long-term risk of dementia. But from observational studies, it showed that antidepressant is associated with a twofold increased risk of dementia. But of course, we should bear in mind that this is uncontrolled studies, so any of the association that we observe could be due to confounding primarily depression itself or the severity of depression, or maybe even like underlying genetic risk. As you mentioned in the very beginning, that there's a familial component there, the link between depression and cognitive impairment. So I would say it's an open question, but something that concerns for some patients, especially older patients and families, and we probably need more well-conducted observational studies or pharmacoepidemiology studies to answer this question.
That's a very interesting point because, as you mentioned, yes, also cognitive dysfunction is actually regarded a vulnerability factor for dementia. So in these studies, we need actually to dissociate which one is the chicken and which one is the egg. So regarding the dissociation between early and late effects of antidepressant treatment on cognitive functions, so acute doses of SSRIs seem to increase recognition of fearful stimuli, for example, which is not what is seen after subchronic or chronic treatment, because as you know from clinical practice as well, people become more positive and they stop being as catastrophizing in the long term with antidepressant treatment. But these differences that we've seen in healthy volunteer studies, we need to replicate them or try to replicate them also in clinical populations, because so far we believe that the reason why we have these dissociative effects is also because acute dosing with SSRIs produces activation of serotonin 1A autoreceptors. So instead of having higher serotonin in the synaptic levels, we actually have lower. And then with long-term treatment, we have desensitization of these receptors, and then we have the net increase in serotonin that we see in chronic SSRI treatment.
Fredrik, any comment on that from Scandinavian point of view?
I'm not sure I have any particular Scandinavian comment on anything, but I was just for my own curiosity, I would like to go back to what you started with when you said that it's hard to measure cognitive function. And like naively from my perspective, I imagine that cognitive function is to some extent part of depression. It could be confounded with anything from age to dementia, like you say. It could be, well, basically it could depend on a lot of different factors. So lately there's been a lot of hype, I would say, or talk that some of the newer antidepressants are particularly good at cognitive function, that there might be a independent or additional effect on cognition that's separate from that of mood. So my question would be if you had any take on that, and also like a follow-up question would be if you took a really potent antidepressant like amitriptyline, which consistently comes out very well in when you look at the HDRS rated depression measures, it seems to have a good response rate and good mean differences, but it's also sedating. Mm-hmm. So if you were to test like amitriptyline on cognition, would you expect that, well, it improves depression, so therefore it's good, but it's sedating, so therefore it's bad? It's like, yeah, how would one untangle that?
That's a very interesting question. So for the first point of it, indeed the newer antidepressants, so multimodal antidepressants, for example, in rodent studies seem to have procognitive effects that are possibly attributed to the increase of glutamatergic neurotransmission in the hippocampus. So that seems to be separate from the mood effects, or at least it is suggested to be separate. Again, we need more studies there, and we need more studies also with clinical populations. For the second part of the question, I'm trying to remember it, I guess the issue is how there is definitely an effect of improving mood on how you on why cognitive functions are improved. I cannot recall of any study having used amitriptyline, possibly because it is quite sedating, so I guess it would be very hard to actually study that.
Mirtazapine, for example, is also quite sedating. Has any study tried that?
Exactly, yeah. I can't think of. So there are many for venlafaxine, citalopram, escitalopram, sertraline. I think there is one about mirtazapine as well, but I cannot recall exactly the details. The issue there is the methodology. So how exactly you measure cognitive functions, as you said. So computerized tests seem to be kind of a hallmark in how we can objectively measure cognitive functions. But again, among computerized tasks, it really depends also which one you're using, because it depends on what you're measuring. For example, in my study, I did not see any effect on emotional processing, whereas many other studies have shown. But that was because of the very small differences that had to do with how my task was designed. So that makes it harder to study. Also, the very widespread anatomy of serotonin in the brain makes it also a lot harder to actually study what are the exact effects. I think we do need more studies in healthy volunteers with antidepressants, older and newer ones, and also we need a larger input of cognitive neuroscience in this domain, which eventually could lead to further insights for the clinical populations.
So thank you all for the very important input in this very stimulating roundtable. I think we all agree that cognitive dysfunction is very important for depression and is underestimated, unfortunately. So from clinical point of view, I would like to encourage our younger colleagues to ask about cognition, because it's actually one of the first signs of depression and it's one of the ones that's recovered last. So it's very important. People are annoyed about that, but they don't link it with depression. And this is where we have to come and help them get a better treatment and actually a quicker treatment. Thank you.
Thanks.